So here I'm going to discuss about modern dental ceramics which are used in aesthetic dentistry. So before discussing modern dental ceramics, let's discuss the background of dental ceramics, how they were introduced. There are four types of material that we used in our daily practice to reconstruct any broken down tooth. And these materials include dental composites, amalgam, PFM crowns, all metal crowns. Among these materials, dental ceramic is considered to be superior from aesthetic point of view. So how they were discovered? Very first, in 13th century, porcelain was introduced, and that porcelain was converted into porcelain jacket crown. But the drawback associated with porcelain jacket crown was found to be its poor strength that leads to internal micro cracking. So they modified that porcelain with the addition of metal. What is the purpose of addition of metal? To impart strength, to provide strength to porcelain. Again, the drawback was found to be poor aesthetic due to the addition of metal. This was followed by the introduction of all ceramic restorations. And today, ceramics are available in different forms in market. So how will you define dental ceramics? A ceramic is a product made from non-metallic inorganic material that is processed at high temperature to achieve desirable mechanical and optical properties. To be used in everyday ceramics need to meet following specific criteria. When you are using dental ceramics, there are certain specific criteria must be kept in your mind. It must provide appropriate toughness reason so that they withstand higher needs to be tough and withstand crack propagation. Second, it must have a suitable mechanical strength to withstand occlusal forces. Third, it must provide favorable optical and desirable properties. And fourth one, they must be durable. They offer long lasting surfaces. So this is the basic introduction of dental ceramics. Now we will discuss about the classification, how they are classified. There are different classification of dental ceramics, but I am here going to discuss on the basis of glass to crystalline content ratio. So there are four categories based on glass to crystalline ratio. Very first category include glass, purely glass based material. That is also known as silica based. Now, which type of ceramics falls in this category? This category includes purely porcelain based feldspathic porcelain, which are also known as traditional ceramics. The microstructure component ratio has a huge influence on the material properties, which will be discussed later on. Now, what is glass? Glass based or silica based? Glass is basically a amorphous solid where the molecules are not organized. They have no definitive lattice pattern. So they are also known as silica based. They are aesthetically superior due to a glass base, but they are weak and from occlusal point of view, they cannot withstand occlusal forces. So this glass category was again modified with the addition of crystalline fillers. Now again, glass based with crystalline fillers, they have again three types of ceramics in which lithium disilicate is very common. They are also classified as a low lucide, low, medium lucide, high lucide on the basis of percentage. Like it is mentioned in this chart. Now they are. This is the first category. Glass based is again it includes feldspathic porcelain ceramics. Glass based with crystalline fillers. If the content of crystalline fillers is less than 40%, they were classified as a low medium. And if it is greater than 50%, then they were classified as high lucite. And third type of ceramic that falls into this category is lithium disilicate, which I will discuss in very detail. Now, third type of category based on glass crystalline ratio include crystalline based with glass fillers. And here you will find aluminium. And the fourth category, that is polycrystalline solid, in which we will discuss zirconia. So this is the classification based on glass to crystalline content ratio. Category 1 include glass based, in which type of ceramic is common? Feldspathic. Glass based with crystalline fillers, it includes lithium disilicate. Crystalline based with glass fillers, it includes aluminum oxide. And category 4 polycrystalline solid, that includes zirconia. This is the chart of this classification. It is also known as Bovira classification according to Dental Update article. Dental ceramics, they are classified into on the basis of glass filler content ratio, या or glass to crystalline content ratio. So here glass matrix ceramics includes mainly, if it is composed of silica, then it will be known as feldspathic. Feldspathic mainly silica with fillers that are crystalline. It is a lucite based lithium disilicate fluoroapatite. And third category crystalline based with glass fillers, mainly aluminium. Then they will be classified as aluminium and magnesium, aluminium and zirconium. Polycrystalline ceramics includes alumina, stabilized zirconia, zirconia toughened alumina, alumina toughened zirconia. This is a Bovira classification according to Dental Update articles. So, what are the factors that influence ceramic translucency? So, it includes porosity of the material, refractive index, and third one is known as particle size and particle density. So first category, now discuss about the first type of dental ceramics that falls into the category of glass based ceramics, that is known as feldspathic ceramics, also known as traditional ceramics, most aesthetically pleasing yet weakest of dental ceramics due to the presence of only glass. They are mainly composed of feldspar and also called quartz and various metal oxides. Optical properties, they are also known for their exceptional aesthetics, resulting from high degree of translucency and color stability. Why they are known as aesthetically superior? Due to significant glass component that reflect and that provide high degree of translucency. And there is also phenomenon known as chameleon effects due to superior aesthetics. High glass content and fine lucite particle allow enhanced light transmission. This is known as chameleon effect. Physical properties, they are known for its brittle nature, inherent weakness. They have low fracture toughness and flexural strength. So where they are indicated, they are mainly chosen to fabricate veneer or as a veneering layer for indirect restorations. Second, they are used for interior crowns, inlay, onlay, nothing else. Now, how will you bond this ceramics? Very first, you will try in that restoration, intraoral restoration, try in. Then you will age 9.8% hydrofluoric acid for 2 minutes and then rinse and then dry. After that, you will clean in alcohol, that is ultrasonic cleaning in alcohol for 20 seconds and then followed by its dryness. Then apply saline application for 20 seconds and dry. Proper isolation must be done. Pre-treat the tooth surface and then bond it with light cure or dual cure composite resin luting cement. This bonding protocol will be discussed in detail with zirconia. Now, second type of dental ceramics we are going to discuss is known as lithium disilicate. In which category this type of ceramic falls? It is known as glass based with crystalline fillers. Glass based with crystalline fillers. Now, lithium disilicate, they are usually composed of two types of crystals. Lithium disilicate crystal that are present up to 70%, and then there is a lithium orthophosphate crystals that are present in lower concentration up to 30%. They are known to be versatile in nature because they have excellent mechanical properties, and they are also have a aesthetically superior, known to be versatile, and they have excellent mechanical properties which allows its placement posteriorly. They can be used in posterior areas. They have adjustable translucency, but they are contraindicated for very deep subgingival preparation in patients with bruxism and with a reduced dentition. They cannot be used. Now, in what are its indications? Lithium disilicates can be used as a veneers, inlays, onlay, partial crown, endocrowns, crowns in anterior region, posterior region. They can be used as a dental bridge, 3-unit bridge in anterior region. They can be used as a 3-unit bridge in premolar region up to second premolar as a terminal abutment. Contraindications, they are contraindicated for deep subgingival preparations. You cannot use lithium disilicates in deep subgingival preparations. So after that, how will you bond lithium disilicates? How will you bond? Bonding protocol includes intraoral restoration trial again. Second, age with 5% hydrofluoric acid for 20 seconds. Now here you will find the lower concentration of hydrofluoric acid. All steps, rest of all the steps are same. Ultrasonic cleaning, saline application, proper isolation, pre-treat the tooth surface, light cure or dual cure composite resin luting agents. Okay. Third type of dental ceramics include aluminum oxide that belongs to polycrystalline ceramics. They are natural metal oxide with superior wear and corrosion resistance. They are prone to bulk fracture due to higher elasticity. Limitation, opaque in nature, leads to poor aesthetics, and they are weaker in biaxial flexural strength. They are used for anterior teeth implant for single tooth cap and anterior 3-unit fixed partial denture. Here are the preparation design requirements. You need axial and occlusal reduction of 0.8, 1.2, 1.0 mm and 2 mm. Use of sharp angle line angles, but shoulder is contraindicated to minimize stress concentration. Then smooth rounded surface transitions and supragingival and equigingival margins. So we have discussed three basic types of ceramics belonging to different categories, and the detail of each type of ceramics were taken from BTJ articles of 221 as well as from Art and Science. Now, last type of dental ceramics we will discuss in detail, that is known as zirconia, in next session. Thank you.